Brought to you by GTA, your island, your network.
Dr. Kozue Shimabukuro, once a top administrator herself, says she's been marginalized ever since coming forward with the allegations during a hearing last week.
Now that I have become a whistleblower, GMH administrators are retaliating by suddenly accusing me in the press, in the public, as me being the sole cause of the TJC failure. This retaliation must cease immediately.
She's talking about management deficiencies cited in a Joint Commission report that threatens the hospital's accreditation. Others also came forward with criticism. Former GMH board member Val Perez says they had little input while he was there, and the medical record system was a problem. Dr. Sam Friedman chronicled a long history of what he claims was inept management and described a hospital controlled by a small group of doctors who were intolerant of change, he says, and very defensive of the status quo.
You can see that there is a survey that went out year after year within the organization. It shows it that people don't feel safe to speak out in our organization because things like this happens to everyone who speaks up.
But another longtime Guam physician, Dr. Tom Shea, sees it differently.
Because all we talked about is the bad things about Guam Memorial Hospital, but without regard to the good things that we've done.
Shea sought to dispute some of the charges, like Dr. Shimabukuro's claim that the hospital lost more than $22 million in billings because doctors weren't completing required medical records on time.
You have to understand that doctors are human as well. So when somebody just says, generalization just says, hey, physician not completing their records, and this is why not billing, that's not true. Okay? And I think that was back in 2014 or something like that. And in 2014, I don't think we had electronic records. So
GMH had a wonderful accountability policies, but we were just not following it. That's all. So again, I sincerely apologize to doctors who took offense and thought that, or told by somebody that I threw you guys under the bus. I did not.
Critics are calling for a wholesale change in the management of the hospital, free of any political influence.
There is a consulting firms just made for health administration to capture revenue and foster a culture of safety. There are people who do this professionally and very much with integrity. So we should reach out to that.
Health Committee Chair Dennis Rodriguez says he's raised that option before but got no traction. Meantime, he's impaneled a bipartisan investigative committee to probe the mismanagement and corruption charges. Senators are also set to decide whether to repeal a sales tax meant to help fund the hospital's chronic budget shortfall. Shea says that would be a major setback.
Don't stop funding GMH just because you consider somebody out here that's a whistleblower and say, hey, you know, they're mismanaging this, mismanaging that. Let me tell you, don't allow me to be in another situation like years before where I ask for a stitch and I don't get the stitch that I want or the suture that I need. Don't let that happen again, okay? Because we do a good job. We have good doctors, we have good nurses, we have good staff there.
For Guam's News Network, I'm Nestor Lecanto.
Brought to you by GTA, your island, your network.